Compagnie has more than 2,300 employees, providing home health care to more than 200,000 patients, adults and children, every day throughout France and Germany. We make access to proximity healthcare a reality. At the core of the care chain, and where community-based medicine meets hospital medicine, Sante Compagnie has accompanied the major transformations within the health sector since 2015 and modelled outpatient care. Our structures enable us to provide customised solutions for each patient, specifically adapted to their own treatment and safety. Partners and facilitators of all the healthcare players, we accompany the medical practitioners in the care of their chronic patients with respiratory assistance, insulin therapy, infusion, nutrition, or ophthalmic injections. Leveraging the strength of our territorial network of more than 91 agencies and our health and emergency medical centres, and the trust of more than 10,000 medical practitioner partners, we have the support today of Ardian in the development of our international growth. We are hoping to mobilize our multiple areas of expertise in France and Europe to reinvent the pathway of innovative and safe community-based healthcare, adapted to the individual needs of patients and serving the public health. Together, we want to give life to a new perspective of care everywhere and for everyone.
When I was a hospital director, I realized the future of healthcare was home healthcare.
L'Arbi à midi CEO.
Ever since my arrival in 2012, I've been working to develop and structure the group. Sante Company has a clearly defined economic model, be it from its gross to its net margin within each and every healthcare sector. We have a quality approach that supports this organization. And this is why Sante Company is developing high-value healthcare services and is concentrating on healthcare sectors where specialization is important.
Whenever a given treatment is possible outside the hospital, we are here to offer solutions, whether they be for home care or services in one of our health and emergency medical centres.
Séverine Dur, VP Strategy and Performance.
We are here to make people's medical treatments easier, and we want our public service mission to be recognised as a more humane and accessible healthcare endeavour.
With Ardian's investment in April 2020, the group has been raised to a higher level.
Choosing the German market, which is culturally similar and as resilient as the French market,
Alexandre Binetruy, General Secretary.
has allowed us to absorb a new company, the Aposan Group, in 2020. Today, Aposan has 150 employees and a turnover of 43 million euros.
Sante Compagnie regroups 3 different business sectors. Our first business sector focuses on home healthcare, available through either one of our 2 networks, Elivi or Astia, and is present nationwide. It also focuses on our German subsidiary company, Aposan, which is the IV and in-home nutrition leader in Germany. Our second business sector is based on proximity healthcare through our UrgensMed network. This healthcare service is available in our health and emergency medical centres, where doctors can take care of everyday life non-vital emergencies anytime from 9 a.m. to 10 p.m. Our third business sector provides dialysis through our isodialyse self-dialysis centre, with the ultimate goal of developing in-home dialysis.
Today's public healthcare policies require hospitals to decrease a patient's average length of stay. Therefore, clinics and hospitals need a partner to provide in-home care. Post-surgery quality service needs to be followed by an equally high-quality in-home care service. This is what people need and find with us. And this has allowed us to grow and to naturally sustain an organic growth of over 10%.
Elan 2025 is a strategy plan we created and which covers 4 different fields: health, innovation, sustainability, and human resources.
Sante Company has a strong development track record. We have shown our ability to expand by developing our networks in France, both through organic and external growth. And we aim to pursue our expansion in Germany through acquisitions.
As a reminder, since 2016, Sante Company has carried out 16 acquisitions nationwide. This outreach has allowed us to strengthen our territorial network, leverage our internal expertise, and care for more than 160,000 chronic patients in France and 40,000 for acute IV treatments. This expansion is more than significant and has allowed us over a 4-year period to double the number of patients we care for.
I believe that today, Sante Company can truly be our public healthcare system's partner.
What's very important to us in our strategy and CSR, corporate social responsibility plans, are the ethical and compliance aspects regarding all regulatory obligations that we need to follow as healthcare player. These are at the heart of our CSR strategy. Today, our shareholder, Ardian, and our Ethics Committee, which oversees the implementation, monitoring and governance of ethics within the group, are both very supportive of our sustainable development strategy.
We support our patients in numerous therapeutic sectors. In France, through our Elivie and Asdia networks, and in Germany with our subsidiary Aposan, a major player in outpatient infusion and nutrition. If today the hospital is the pillar of our health system, we are building the foundations to support it and connect it to community-based healthcare, in cooperation with all the health professionals. Today, we are present in all care fields, from hospitals to home care, but also health and emergency medical centres. We are developing home dialysis services through our isodialyse facility and provide patients with non-vital emergency services in our Urgence Med medical centres. Sante Company's mission lies in the alliance of the human element and technical excellence to serve patients, health professionals, and the health system. We look to provide sustainable and humane home health care throughout France and Europe to serve the well-being of our patients. The more we diversify, the more our role makes sense.
Our executive committee is rich in talented men and women from the healthcare sector. We have a medical strategy director. He's a physician who has worked in the public health sector and with the health authorities. He's drawn up several public health plans on various topics, including sleep apnea syndrome and obesity.
What we need to know today is that we need to develop outpatient care. And that's our specialty.
Dr. Jean-Pierre Giordanella, VP Medical Strategy, Public Health Practitioner.
Without minimizing the importance of the medical treatment itself, we need to develop a personalized healthcare system, or treatments will be nothing more than technical or mechanical tasks. Medical treatments aren't in question. The real question is how long-term patients can get the same high-quality level of medical treatment in the best conditions so they can comfortably live with their illness. In other words, we're not just treating a patient, we're also caring for a person. Personalized medical care isn't that easy.
The close relationship to doctors and prescribing services in hospitals has made Sante Company one of today's leaders in the medical community. Thanks to our expertise, our nationwide network, and our in-network healthcare centres partnerships.
These days we can find all types of partnerships.
Adil Lebal, VP Strategic Partnerships.
We can have institutional partnerships, partnerships with associations, with public hospital networks, with private hospital networks, or with assisted living retirement homes. We've started a prevention campaign through local pharmacies. We truly believe in our mission, and it's also fundamentally rooted in our CSR policy. Our objective is to raise public awareness on public healthcare issues.
Today, we have entered the era of medical performance. For example, sleep apnea patients are all monitored remotely. As a result, we receive data uploads for more than 120,000 patients every day. This allows us to keep our billing process updated according to our medical performance, thanks to remote monitoring. This also allows us to interact with health professionals and therefore doctors.
Follow-ups are essential. There's a follow-up visit when the patient is set up, then a follow-up on day 1, day 3, day 7, day 15, day 30, then every month for 4 months. In addition, if the patient encounters difficulties, or if we realize that what we're doing isn't enough, we'll add more visits to help the patient adjust.
As we said before, we work very closely with all doctors. The expression hand in hand is more accurate. We work very closely with these service prescribers. These healthcare professionals, whether they're in hospital or in their practice, entrust us to give the best medical treatment they can prescribe to their patients. The least we can do is keep the doctors updated daily on their patients' health and the data we collect. You need to understand that all our medical treatments are tailored to the patient every day.
We'll never adjust the patient's settings without previous approval from a doctor. Hence the importance of building a trustful relationship with the doctor in order to work quickly, so the patient's condition can be improved as soon as possible. That's why we train technicians to not only educate and be open with patients and caregivers, but also to be encouraging and motivating when things aren't going well, so patients can fully benefit from their treatments.
The relationship between the prescribing doctor, the service provider and the patient has to be a trustful one.
Corinne Navarro, VP Patient Care.
Communication between all parties needs to be clear and unequivocal because our common goal is the patient health and well-being. We're a multidisciplinary team. We work with freelance nurses, speech therapists and physiotherapists who all do house calls.
Donc on va faire le point du coup un peu plus de façon détaillée. D'accord. Orthophoniste, kiné, et puis du coup avec Sébastien, l'infirmier, ça se passe bien aussi.
Et bon, avec l'infirmier, impeccable.
Our employees are health professionals and are the in-home eyes and ears of the doctor.
The professional teams who visit patients in-home become very close with them. These patients sometimes tell them things they wouldn't say to their doctor.
Stéphanie me livre une fois par mois. Et puis donc elle vient me piquer, remplacer le produit tous les jours. Il y a un échange quand même sympathique. Hein?
The quality of home care services plays a decisive role, yes, of course.
There's a whole team behind a successful treatment experience. The LEV network is what connects the service prescriber to the care provider. LEV are the ones who collect the patient's information and update the doctors. They're efficient, and all works well because everyone knows their job and everyone relays the information.
It's all about sharing, mutually sharing our experiences. We tell them everything we know about our patients, the disease, how it evolves, what to expect, and they give us feedback on their experience and on what happens in home.
Voilà, j'ai rencontré Élise il y a 2 ans pour la mise en place d'une pompe à Poquinon. Élise m'a tout expliqué de A à Z. Elle connaît très bien le procédé et la maladie.
It's important to understand the different pathologies, as well as the patients and their families' needs and requests. You cannot improvise yourself a healthcare service provider, regardless of the pathology or the type of care. Improvising such a thing is not ethical.
Within Sante Company, we have a training centre. All recruited team members must go through one of our training courses, depending on the specialty they've chosen, be it respiratory, IV or insulin treatments.
Virginie is the nurse who took care of Mathis since he was diagnosed with diabetes.
Moi, je mets au centre et toi, t'appuies sur les côtés.
Il était arrivé à l'hôpital.
He got to the hospital on a Friday night, and I went to see him on Monday to bring and set up his pump. The pump is the most suitable device for managing infantile diabetes in children under 5. Right from the start, I told him I would always be the person coming to the house, so he could identify me as the reassuring person who would be helping him manage his diabetes.
On va essayer ce soir.
Si tu veux. C'est assez grand pour toi, Mathis. Hein.
Mais on va la mettre ce soir.
Tu veux la mettre ce soir? Si tu veux mettre. Ah oui, c'est assez grand, hein. C'est vraiment important.
It is really important that the child not identify this healthcare period as something unpleasant, because the treatment itself isn't very painful, but will be chronic and repeat itself at least twice a week for months or years.
She really helped us set up a system and technical gestures. Then we found our rhythm and our habits. The good thing is we didn't just read a brochure. Someone came and explained it to us, and well, yes, it was her.
The quicker we're involved in the healthcare treatment, the quicker we can provide a global healthcare treatment, allowing parents to autonomously manage the diabetes. Patients need a helpful healthcare system that is easy, reactive, and in their proximity. The COVID pandemic highlighted this issue. We saw the pressure hospitals were under, the difficulties people had allocating resources, whether it was in hospital or in community-based healthcare centres.
The most complicated thing for us to achieve during this pandemic was caring for our long-term patients with chronic disease, COPD, diabetes, or Parkinson's disease.
The home care service providers quickly came to us and said, "Listen, we can help you. We can lend you ventilators, Optiflow devices, and for in-home services, we can be there for outpatients who need short-term oxygen."
J'ai bénéficié d'une prise en charge qui a été très réactive. Le technicien nous a apporté donc une cuve assez importante en oxygène. Ça, c'est ma machine on va dire, pour l'oxygénation. Dès que je désature, je la prends avec moi. Je suis entouré de ma famille, oui, de ma femme et de beaucoup d'enfants. Et j'estime que la famille, ça n'a pas de prix et qu'ils sont là, quoi.
For us, we knew that our patients were being monitored by the nurses and the in-home service provider. And that was reassuring, especially for patients who were touch and go right after post-COVID.
Today, COVID has proven that home healthcare is possible. Thanks to our partners' acknowledgement and to the doctors' gratefulness, I believe that Sante Company's potential and quality will facilitate future home healthcare. Furthermore, in order to treat in-home patients, people will systematically need Sante Company's services.
We've only been working with Elevie for a very short time. First, we wanted to set up our medical project. Please understand that the treatments we offer aren't opposing treatments, but complementary treatments. We're lucky to be using a new service provider who's so active in this business sector because it will allow us to establish healthy relationships with a medical team who can oversee the patient's medical treatments and a paramedic and logistics team who can ensure an in-home quality service, as well as guarantee a daily exchange of information between the patient's home and their hospital. There are very few people in France right now who have in-home dialysis. We can't force people to be autonomous. We can only show them it's possible and reassure them. These patients are often waiting for a transplant and are eager to stay home and not have to deal with public transport or hospital life for their daily or weekly dialysis treatment. We know that 20% of all dialysis patients could easily be in-home patients, and that with a little work, we could increase this number to 30 to 35%. If we have in-home healthcare service providers who can guarantee a tailor-made treatment in cooperation with a medical team, then patients will have a positive reaction, and the results will be good. We'd have excellent results.
As a reminder, since 2020, we've also put in place a medical services strategy to go with our home healthcare service, which gives a more attractive and meaningful aspect to the people and the project itself.
That's exactly right. Today, Sante Company, his project, our project, needs to be present wherever a patient needs treatment. Wherever today's public healthcare services are lacking. In 3 months, we can build and open a health and emergency medical center in a medical dead zone. We'll never be a rival to a public healthcare center or to a medical practice.
Dr. David Bounan, emergency doctor.
There's a very high demand for physicians. We've been handling a large number of consultations that general physicians no longer have room for. We've also been seeing an increase of patients who would normally go to ER, but who finally trickled down to our centres. We have a doctor and a nurse every day who work together from 9 a.m. to 10 p.m. That allows us to accept all types of patients. We can handle all types of simple emergencies as well as everyday general consultations. The only thing we don't handle in our facilities are serious life-threatening emergencies. If you need an X-ray, an ultrasound or a CT scan, you can get it within the hour. Our medical centre can treat almost anything, and I think our patients appreciate that.
Aposan is headquartered in Cologne and operates nationwide. The business focus is on pharmaceutical home care. This is the combination of pharmaceutical production of individual infusion solutions, training of patients by certified nursing staff to enable infusion therapy at home, and delivery via associated pharmacies. In this way, we create an efficient and unique product and service portfolio to reduce hospital stay days. 3 main business units contribute to the turnover. First, OPAT. This is outpatient parenteral antibiotic treatment, and Aposan plays a leading role in the market here. Second, clinical nutrition with tube feeding and parenteral nutrition. And third, the supply of ophthalmic surgeons with syringes for the treatment of wet macular degeneration. Sante Cie gives us the freedom to drive organic growth within Aposan and supports our commitment to potential inorganic growth. The focus here is on integrating of home care companies with a broader home care approach with synergies to existing Aposan business. This is our contribution to international growth of the Sante Cie Group.
The Sante Company Group operates on a market which benefits from various long-term underlying growth drivers. Our growing market share ushers to a leading position in a fragmented market where significant barriers to entry still exist. Thanks to our rapid development, supported by both organic growth and targeted acquisitions aimed at increasing our offer, our geographical areas and our expertise, Sante Company has become the most dynamic consolidation platform of the sector. Our strength lies within the diversity of our expertise, our partners and our territories. The aim of Sante Company is to guarantee a better access to healthcare for everyone. This essential role in our society came to the forefront during the COVID-19 crisis, where we had to ensure the continuity of care for many chronic patients. Confronted by external impacts and regulatory changes, we rely on the resilience of our activity and our performance. It is based on our ability to innovate in order to improve the efficiency of the care pathways and meet the needs of each patient, mostly thanks to technological evolutions in the field of telemonitoring and e-health. Strengthened by these levers, our ambition is to pursue our development in Europe and continue to create value by reinforcing our presence in the healthcare chain.
When looking to sell my company, it was fairly easy to go with Sante Company.
Catherine Serre, VP Quality Management and Internal Audit,
Their reputation is one of competence and seriousness, as well as having a nationwide network. They also have a healthcare strategy, which means they strive for efficiency, just like the group advocates. When you sell your company, you sell something you've created and that you love, and you want to make sure its essence is preserved. Medicil continues to operate in all its previous sectors, but now has more resources.
Today, investors are looking for resilient, growing sectors. For the past year and a half, we've seen that healthcare, and especially home care, is very attractive.
Rémi Masson-Regnault, VP M&A.
At the same time, we at Sante Compagnie are digitizing our approach to patient pathway. So yes, we're investing in a resilient, growing, digitalized sector, and everyone is satisfied with that. In an acquisition, in order to get 1 + 1 = 3, you have to help develop the structure. Make sure the structure is successfully integrated into the internal Sante Compagnie processes, achieve synergies, etc., all while making sure you don't break the structure you've just bought. And above all, you need to preserve the expertise of the new acquisition.
There's a very strong desire for external growth. Let's just say the projects are numerous and permanent.
Yes, we're very confident in our company's future. We have the ability to continue to expand Sante Compagnie, to find other acquisitions, and develop new businesses.
Today, we've reached 320 million euros in sales for 2020. Our goal is to double our turnover and exceed 600 million euros in sales by 2025. Because our company has grown so much and we have expanded internationally, and because we have additional projects in the works, our plan, our strategy, is to be readily available for any hot topics or societal issues on which we can share our know-how and use our internal skills and networks.
Sante Compagnie has been pursuing its outreach in France and in Germany. But we need to continue to grow and develop our network in other countries. We're closely looking at the Belgian system. The Belgian system is very interesting because it centers around hospitals. So we feel that the Belgian market could open up soon. We already have a few contacts and a few companies in target. We're also looking at other countries such as Switzerland. It's a small country, but the average income is important, and the outpatient model needs to be developed there. Thanks to Germany, we have access to countries like Austria, where we also have a few contacts. Finally, as you may have understood, Sante Compagnie's new goal is to expand into other European countries.